Ho 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 ho. Da 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 da. Da 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 da. Um. Mm, 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 mm. Oh, da, 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 da. Okay. All right, so this evening, good evening, good afternoon, good morning, baby. I will share program ye a free beer. We are live here on YouTube, and yesua adieno. We are discussing uterine fibroid, and no, and yeba abisuano enyumre enti ubetumi aba na also waba be enjoy discussion ni bi Ellie Sophia. Welcome, sister. You are welcome to this chat. Obi a waba so bia no yesua about fibroid. Enwumre said ye mumododo na mo kan no e wo TikTok live no so no. Ye ba say ye ba behwe na ya bedi nkomo about fibroid. Bibi a opese wusa, bibi a opese wuhu efa fibroid ho no. Ubenya akwanya no na won so watimi ebisa. Sanso na bibi a opese wote ase efa fibroid no ho ne ma bebre na wate ɛwɔ fibroid ho a wonhyɛ da nte aseɛ bebree anaasɛ wonhyɛ da nhunu nea wonyɛ ɛmfa ho wobɛtumi aba na waba bebisa ɛwɔ ahanom ma mentwa ayi na menhu na ɔmo hu sɛ we are live on ayi ɛyɛ okay. Tudun. Okay, ma men post to ba I mean twa nkyerɛ ɔmo sɛ yɛwɔ ha nti ɔmo mmra. Okay. Enti ebusuafo me ma mo nyinaa akɔ aba mo ama ba ne nyinaa mo mmra na yɛnsua adeɛ privy me your life mpacho enti bra so na nso bra na yɛnsua adeɛ na bebisa wo question bia wo pɛ wo bisa okay. 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 Enti abusuafo enwre ye discuss eye me dey akoto TikTok. Enti wo TikTok wa be hu bia no. Bra na be join it na yensua about fibroid. Enti enwre de wo beti bie ni say hey edin de just say wo ba ha no ama me hu din o. Hi zo hey edin be yire wa ha zo we hwan ya hi zo tu he hwan no aklisali okay uba no wan kire wo a me hu o mpa che uba no me hu nipa kro TikTok for no okay so we are discussing fibroid. You trying fibroid yeah cause a fibroid kra e de be ade de na be wadwene mu wote a e wadro bi a ye nom ye wo ye local herbs bi ene ye be hwe ho no pa ye wo local preparations bi a wonom a ebetimi ama fibroid nanane ye wo aduro bi wo ho a wonom a ebetimi aboa ma fibroid na etimi afiri ho kra so oba nyim no fibroid sunsunsan so ne sen ebetimi ase ne nyinsen no me wo fibroid na me pe nyinsen a metimi anya nyinsen ne bia na me nya ena afa yi nso fibroid no ahodo ne sen ehe fa ne da ehe ne da ehu ehe ne da mentimi mfa nyem fibroid no eye kese sen a na ese ekoyi ana fibroid me hu se me wo fibroid na esa me ko na doctor eyi mami ana sa niema yi na ye ba na ya ba be discuss no ene anwumre enti ba bi a wo bia anwumre no bra na yentumi enhye de I see you who they want me and see me G tell me who so she ho ebusafo what ba na wa share wo betimi a share live na wa share live no na wa share live no ama bibia aye kama what the hearing dabi nyambo chana biare ana dia foto enti wo abaso a share live no na afi ye nyina ye mum na yensua ade de me hia firi ho an se wo be share na wo like it wo share na wo like na atimi ama na kwa akiri na nkrofo so atimi aba be join na ye nyina ya bomu atimi asua ade no enti anwumre the GGGG squad no mo wa ha monkoso na mon time achi saa na nyina yem promote maternal and child health a very important enema bebre na ehia se yesua enzi abusuafo monkafra na yentimi ensua ade nkakra ebefa bibia be fine na yesua enti yakoye nim no ye ka se fibroid sister fibroid de ade na ye ka ho asem obroni be ka se a benign tumor or benign growth that grows in or around the uterus enti the moment I be ka fibroid asem no e wa wode no ho asem na ye ka the moment you hear fibroid ye ka fibroid ya de be ba otrim say na ye ka ma wode no ho asem o ye nya ka fibroid pe ye ka wa wode ho asem now fibroid if you free wo hefa fibroid no it is made up of tissues and muscles first of all tiasiesa ye ka fibroid it's made up of tissues and muscles that is what is made up tissues and muscles first of all wunya tu we na sia afa na wo bebisa ho say ene say you see fibroid no is made up of tissues and muscles dia ebetimi anane ana very very important question abusiafo wa ba so anu try so be share live na ma wonu bi a o YouTube a wonim no the more I will share ba ko mienu miensa na bi obi abe join na ye nyina ya bomasua de no if it is made up of tissues and muscles bisa say ebetumi anane ana a very very key fibroid no ebetumi anane ana ade ye honam sei ninu mienu ye honam we etimi nane tissues enam ewom ebetumi anane ese obi sa ho kwesen se nti se wokote se obi se me waduro metimi ama waduro ama o fibroid na nane metimi ama woduro ama fibroid na nane me woduro ho me de bemma wo fibroid no benane enye hwe metimi ama woduro na bisa ho se fibroid no betumi anane ampa na because you say ye honam muscles ubisa ho sa questions we beboa because why anya ne saa ebem wa nipa ne de na wo kana di say ampo mo say fibroid no etimi nane ye woduro ma minsi so bi po sesi anka chiro say currently you ni eduro bia etumi nane fibroid. There's nothing like that currently. So bi ka chiro say ye waduro etumi nane fibroid a sini who obwa. The person is just lying to you. Obwa. You need a eduro bia nane fibroid, my sister. Take it or leave it. Obi betimi aka chiro say o waduro betimi nane fibroid no. Me say obwa. Currently eduro bia ni ho a ofa ebetumi anano fibroid. Na fibroid na he na eto. Ye wo munchiche mu ba miensa. Ye wo de to wa wodie ni mu. Obroni beka say submucosa. Ewo wa wodie ni mu ba bia akora ba oba betare no. Eho no mo na eto. Eho ye baako. And ye wo the commonest part which is the myometrium and I say within the uterine muscles. Wa wodie no enam na ema eye wa wodie no enam no emu na fibroid no ekotena na ekoto. And at the third one no so your friend say subserosa na say eno ne da wa wodie na chi da wa wodie na chi enti da say da wa wodie no inside submucosa enti ko na say submucosa type of fibroid na say fibroid no da wa wodie no mu ba bia akora ba oba betena no eho enetare. That is one type. Ana ewo de eta enam no mu the uterine muscles no ankasa awode ne nam no eno na edem etenam. And the third area so ebetena eye subserosa to say eda wawode na chi nti sa empem bebre and sometimes no o service no ho so ebitimi koto ho. Na ye wo ba ku ye say pedunculated na say da wawode na chi a develop wings akobese na enya man wings ena atre what I see. So that is the pedunculated. It's a atwatwa. Na ye pe ba bia eda pa de a biaye miensa either say fibroid na bekwa da wa wodie ni inside ba bia wonyem akora kotare no eho ena ekwa kotare ana say wa wodie no nam ni mu eho na ye commonest pa nti wo bu say ema dodo na fibroid no eda awodie no nam ni mu uterine muscles no empem bebre ba bia eda no especially uterine muscles na ye common part no entai nyansunsuanso wo nyinsen so. Now se nyinsen ebetumi atena na ntumi ntena o fibroid no ejina niam bi so. 1 fa na fibroid ne da. 2 edien signs and symptoms na minya. For example, me fibroid na yekese agi awodie ni mu afa enti ba bia me ne be mehia ensuo ne fa na ekoduru tube no mu ho no fibroid nam emia ho saa area no nti bi wo ha ma ne ye den se ensuo no kura be fa ho akọ tube no mu eba saa ebi wo ho a etimi ma ne ye den se nyinsen be den ebeba anya saa impem bebre fibroid eni ayi ye friend say eni ohaw fibroid and ensi nyinsen kwan. Impem bebre fibroid does not cause miscarriage. Impem bebre fibroid and cause miscarriage. Oh, fibroid there is no way say wuntimi nyinsen. Oh, question bia fa fibroid ho afabra meto me boase na mayi ano ede amount. Oh, question bia fa fibroid ho anwumre just write it here. I will answer it for you. Obia wo question bia fa fibroid ho no just bring it now. I will answer it for you. Fibroid ade ba ko a ebetimi ama wo hunu se wo fibroid ebi nie enema ben na ebetimi ama hunu se me wo fibroid. 1 ebi wo ha unkotwa scan no de unkotwa scan na mekan signs and symptoms. Nti niema be na metimi hu. One. Ebi o wa menses no. Eba bebre. Nti na me ka kire wo say, yesua menstruation me ka kire wo say, menses ankasa no. Ye nhihye ne senka emra bebre continuous emra kese enyi bum bum dabi. Nti se wo ye obi a wo menstruate se nya sa na ete. Ba se say de wo menstruate a eyiyi clot, eyiyi akese a emma wo na enyi bebre. Kona kwa ye nhwemu ebia na ye fibroid. Hey, Elena baby. Elena. Chale me checha. Good evening, dear. Good evening. Oh, chale my idea, some joining. You see, dear, we are discussing fibroid. Some custom bantimaba. You are here. You day, Chale. Thank you for joining. My baby poo is green. Is this normal? Sister, you're normal. Why? We are memo be a question. A time no be a question. To me, fibroid kakra. Then two, I had the moon to me and said TikTok. I had the bay in kakra. I haven't been from Masoroha. Mabet, your mother can some market me. And then I have a dean kakra. I have tassa. Where why Janice? Janice, ya I will be to me, Mahame yet. A emet mungu so. I have a gentle, I have quiet, I have gentle. Umpo. Hey, I was yabana, atasa woman. While we didn't they say, Uba was atasa. Utri so, we more quiet by why. Nice one. Doctors so about doctors labby. Sister doctors. Mu and a montimu would dear there's an master said dimbi and no money and they are doing who be sad at the adeno. Samora. Tell them share live nib my mushe mamuni am no rami and discuss fibroid. They say meta me TikTok live my be YouTube was live kakra just to who won't follow yes no follow aha ni nsua de. Yeah. So now symptoms ni being say o menses ne ba eyiyi clot e ba akese na wo bleed bi o na wa ye mre bi o kra wontimi nyusu normal pad no aye say wo yusu bia diapers na pampers na wo de ache emoja no ntia no e betimi atwe odwene say ade ye fibroid na me experience ya na eno ye one. Two, wo betimi nso ahunu say wa ya asetimi ya wo ya lower abdominal pain. And also, how menses never so apart from say we bleed, it also comes with pain. Na pain ni bi also with or without menses. Either say menses eba and now menses nyama still fibroid no betimi am why then we experience pain. Pain ni bi no den why see ya. So that could tell you that possibly you are experiencing a fibroid and that's all fibroid. 3. If you are yes sexa na ye wo ya a friend said dyspareunia yes sexa woni be medi en paso akatima kapen ta pepa wani abre na wode atoto ano na wode fafifa fafifa bi aka mo be keka ne masi ani na bo se na afei wo Philippines papa no sha se wo pro ne widiem kakra bi a fi na wo se wo na wo ya se wo ya ho chiro yes wo pro ne widiem kakra bi na ho chiro tise bi owujai tise obejai o be do na ne mbotu ahyeda anytime bia obekasa mo be yetata bia no na wani wonsu no gugem na wo yam hyehyew wonya de to ano hai na wo yam hyehyew kwasi ofori ana me chiachia vida ni nyina ye science ni bia do ye sex a na ye wo ya was it what he means his language and tells you Risi anyway. So we are discussing fibroid and I'm saying that some of the signs of fibroid is when you are having intercourse, when you are having an affair with your partner, you could feel pains, and sometimes too, when you are experiencing or when you're having your menses, you could experience severe form of bleeding. Your bleeding could be coming, excessively, in larger quantities. When you are flowing, your menstrual flow will be very heavy. That is what I'm trying to say. And also you feel severe lower abdominal pains during menstruation. These are all some of the signs of menstruation, fibroid. If somebody is, I mean, if someone is suffering from fibroid, possibly these are some of the things that the person is likely to experience. And when you see some of these things, it is very important that you report to the hospital for proper assessment and, of course, management. So these are some of the signs of uterine fibroid. And again, you experience low abdominal pain, you experience sometimes constipation, you find it very difficult to poo, and these are all signs of uterine fibroid. Having said that, it doesn't mean that if you're experiencing any of these signs, any of the aforementioned signs, it does not necessarily means that you are experiencing or you are suffering from fibroid, or you've developed that growth in your uterus. You have to go to the hospital to, as it were, get some of the things done. I mean, you go through the protocol to get ultrasound scan done, and then the necessary investigation is being done for you to ascertain or to confirm that indeed you have uterine fibroid. And of course, so fibroid now, and yes, no ye free ho. Science no, ebi nso ne say, wafutimi ye kese. Some people develop big abdomen. Their abdomen becomes bigger. It protrudes. It shows that probably you are pregnant. Somebody looks like a pregnant woman. Somebody with a fibroid that has been, that is grown bigger. It will tell you that indeed you are, Dorcas, you are like, you may be, thinking that you are pregnant. But you go to the hospital and they do an ultrasound scan for you, realize that it's not pregnancy, but indeed it's rather uterine fibroid. So these are the things that you have to be very, very particular of. Some people who have been trying to get pregnant for so long, when they get or develop that big abdomen for some time, they think that they are pregnant. No matter what you tell them, they still think that or feel that they are pregnant. So when you ask them to go to the hospital to get, some of these things done, they think that, oh no, this is not a hospital matter, this is not blah blah blah. I'll go to this herbalist, I'll go to this local man to do one or two things for me to, as it were, help my pregnancy to grow. And you know, correct. Ye ni bibia say, ebetimi ama onyinsɛn no, say nyinsɛn ni hɔ a ɛbɛma wanyam. Enti obi fibroid, ebetimi ama wo yefunu ayɛ kɛse. What you say? Wo fibroid a, ebetimi ama wo Eunice Asamoah, Eunice ya hwan. Bonjour, bonjour, Benjamin. Welcome, welcome, welcome. Wo fibroid a, ebetimi ama wo fu ayɛ kɛse ama wadwena yɛ sɛ wonyam. Tie ni ye, obi ho a wapanyin nsen a che. Ɛna na fu yɛ kɛse. Na fu na ayɛ kɛse no. Elena. Me feel what it. Na fu na we dey wan kope baabi a na me block o, what it. We stress me. Mo am ka ho be na me ntimi nka brofo no. What it. Na fu na ayɛ kɛse no. Oben na dwe sɛ wonyam. Enye nyinsen. Obekɔ hospital na ebehwɛ no. Na a uterine fibroid. Into wo hona wo so wafu ayɛ kɛse, what test pregnancy wonyam. Go and find out why your abdomen is becoming bigger. Sometimes a bit might say a fibroid. Okay, Kelly Collections. Oh, okay, my sister. Oh, you are welcome. TikTok phone in your name, Damase. One many moody Jumain. Also, I will TikTok. I will join in. No, follow me on YouTube. Midwife Johnson page. We are and I'm Didi Jumano. Yeah, let's continue to follow and then share the life. What you say? Any soon idea. Yan shall be high. Minya fibroid there near a year free mamiana. The answer is no. In fact, fibroid is so common, say. I say, midwife here, she won't help you. Obesreme, Mama B8 Ventures. And the main camera for now, I say, won't me menyamins remu, my camera for no. So now let's look at it. If I have uterine fibroid, does that mean that the doctor would have to take it off by all means? I mache, yeah, mache, yeah. Does that mean that, it has to be taken right away? The answer is no. Sometimes your fibroid will have to develop to a certain, limit. And before your fibroid will be taken out, or before myomectomy will be considered, they look at one or two things. One, the location of the fibroid. Where is it located? Two, the signs and symptoms. Okay, what are you experiencing? Is the signs and symptoms so much that you can't, bear it? They consider that. And then, of course, they consider the size of it. So is it too big that you can't, live with it? You find it very difficult to live with it. The fibroid has become bigger. They consider some of these things. I don't know when so make me tree, won't tree amonko. Mama bana munti tree na hanya modia monko. Why? So you have to know that before myomectomy will be considered, when we talk about myomectomy, it's surgical removal of the mass or the fibroid, okay? So before that will be considered, your doctor would have to look at these things. And of course, before myomectomy will be done, several tests will be done to check your FBs, your HB level and what have you. Your doctor would have to make sure that you have enough iron, your hemoglobin level is very good, okay, because of the risk of what? Bleeding. So they consider all these things before myomectomy is considered. And of course, you have to also realize that when fibroid is taken out, or when the mass or the growth is taken out, it doesn't mean that you cannot develop the fibroid again. Okay, the one that has been taken out is not going to grow back. No. However, sometimes there are smaller ones that are left in there, which probably in future they will also grow to become bigger. And again, around that time, when it happens like that, myomectomy again will be considered, especially if you are trying to get pregnant. So what they normally advise is when you, undergo myomectomy, or when the fibroid is removed, mostly around 6 weeks, or from 6 weeks, 6 months, 1 year, you try to get pregnant, because they can what? There could be another growth. The smaller ones that were left in there, they could also grow back to become bigger as the one that was removed. So when you do myomectomy and you have a partner, you have somebody in your life that you are living with, you have to try to consider pregnancy, trying to get pregnant. Of course, there are sometimes you try, it's not coming. That is different ball game altogether. But you have to try, make a conscious effort of what? Trying to get pregnant. And if it comes, hallelujah, you try to give birth, because it can grow back. And you don't know whether it's going to affect your chances of getting pregnant or not. And I don't think you want it that way. So when it happens like that, you need to do your possible best. You try as much as possible to try to get pregnant after myomectomy. Alvin. Stanley, be use your man why? Okay, and brofo ntimi num nsuo pa. Brofo no ama me emwa me kra, brofo no ama me num nsuo too much. Brofo no emwa me num nsuo too much. So na me bre. Brofo say na brofo ne kan na fom. Kan brofo bia na is a num nsuo. Nsuo, oh mo share. Num nsuo. Nsuo. Enti yan hwe. O fibroid no ba bia da. Se doctor se obeyi a, brofo no de hia nsuo. Gigi ena me twim anim, me de brofo no twim. Mpo. Dem bati bia mo fa no saa. Hwe aguso so na ne ade a. O fibroid no, e ma bebre o fibroid o but mo nnim. E bia wo hwe me. Wonyam ye ansa na wo hospital a doctor hu say wo fibroid o ka kire wo. E ma bebre o fibroid. Anti-fibroid, it does not necessarily prevent you from getting pregnant. No. Fibroid in most cases doesn't prevent pregnancy. So oba wo fibroid a, utumi anyam still, obetumi anyam. Oba wo fibroid, obetumi anyam. Fibroid nsi nyinsen kwan. E na oba wo fibroid na wonyam a, enye obia na ye beye ne surgery eyi akra no. Because yes, dabi. E ma bebre o fibroid, o matumi awo afọ mase. Enti wo fibroid a, susuma no nya headache. headache. Or baby ho koya catch and so fibroid no was susa there be. I mean fan to me hakra. So met me dia to me status ana meboa. So met me dia to me WhatsApp status. Na me tin fan to. Aha, met me dia to. Me dia to ho. Obi obehwe bia o me join it. Oh yeah. Okay. My join me there too, so I fine. Yeah, me there too. Now where hwan zotu hey hwan hey hi and I say hey. Oh yeah hwan. Hwe ni tiri nwi fefe bia egu ho. Hwan zo mo de mo. Ntena hoy. Okay, yen to aso. Enti wasa yesua no, ye kwaso no. Wo question bi a obetimi de aba. Wo da won kan pa kura me amehu, wo de tena ho. Mehu. Ye kwaso no wo question bi a. Oba Jackie. Hey, na high zozo wo de wo. Moderator one. Na we de ko fa no. Hey, din video mo di bi na momo. Okay. Cutie. Okay. Shoo. Okay. You know we. All right. Yanko yenim. Okay. Okay. Yanto aso. Now yan sha de bi wa high. Obi wo ha na fibroid na yekese. 9 centimeters, 10 centimeters, 11 centimeters. Ayekese. Sister, enti wo hospital na doctor so obeyi ama wa. Mani nyima wo. Ade ba ko a fibroid etimi ma ne ha adwen ne se. Fibroid ankasa ye ha adwen bebre. Se ayekese na wa ma ye anyi amfiri ho ama wo a. Ebetimi aduru ba bi a yebeyi wa wodie ni nyina afiri ho. How can we request and ask questions? We that can't write. Any de be yiro. Say no de em say de bibia say ni ho. YouTube de em say bibia say ni ho na meboa. YouTube de em say bibia say ni ho. YouTube de em say I just say oh yeah. What trouble? To montromra. Montrom questions no. Untimi ntra fama oba no ntromra. That mean Doctors, pe oba no ntroma na mbra na menken. Enti ye be live wa ha say me bi wa ha. Na akoye bi wo you can't request here. Yeah. Ye be bi wa ha. Na akoye ya kwa TikTok wa na akwa sere kakra na ya ba ha na abeto aso. So what I say because I have here I have to grow this page as well. Very very important. Mr. T bre bi na mi jaye. But I think section come to aso as abre. Enka ye koye nimpa. Ode no ho mapeke mo why mapeke mo. I had the intimate pick him. And they say meta aba life wa hapa. At least nipa aba so no kranya bad. It's very encouraging. First time for some time now. It's very very encouraging. Now yan to aswe. So fibroid na yekesi a. Wonim say fibroid no intini na sesa ho en na nourish fibroid no. Nti etimi duru ba bia etimi yekesi a veins no vessels na connected to it. It may rupture and you can bleed severely. Mini abahwe no ye enti wo kwana se fibroid na yekase be yi amawa gitum na yenyima wo intine na connect no vessels na connect no blood vessels no it can rupture high VVIP ebetimi a rupture eventually you can bleed to death. And hardly so better says fibroid kumubi. Hardly you hear that. So better says fibroid kumubi intense. The fibroid kumubi there be fibroid in term kumunipa. Fibroid in kumunipa. This is what we are so thing. Fibroid na yekese. Yesi ebe you was a woman pene. Yesi ebe you was a da. And ya yekese aji wa wudi mfani ye one day can rupture. Was it at what point can it be removed? The point a bit may remove to say one, depending on baby adano. Ebi a pesa wo. But aje wa wudi ni mu aboso. Doctor be consider so be. And I say signs and symptoms na we experience no. For example, we sex bia na wa ya se ya wo ya. We sex na wo bleed because of the fibroid. Again, why has it me ya wo ya untimi nya hwe. Ebiem o menstruate a eyi clots na wo bleed no wa ye mremremre anytime I will be menstruate bia na fie jadum you bleed with clots. Doctor will consider so be ye free ama. Ama wo fo ye kakraka. Fibroid does not move. Fibroid enante. Fibroid does not move. It remains as its original place. It does not move from one place to another, just like a baby. So somebody will be saying, "Oh, I can feel something moving through my tummy, blah blah blah, and stuff like that." No, it doesn't happen. Emma, hey, Emma, Ado, hey, hoya, Emma, Emma, Anna, yeah, akwaba, what? You can't go anywhere without me. No. Hey, humble baby, where they am pa? Me da na me jawu. I can't go anywhere without you. No, Charlie. Welcome. Eh, so are you ready? Welcome. Why? Welcome. Me mo akwaba. Me chia wo ne akonta ne baby why. Thank you for joining. Enti signs and symptoms no doctor ebi a na nye kese bebre, but because of the signs and symptoms na we experience and I say niema we experience wo komu no doctor timi gina so say ma me nko you fibroid ne ma because ama wo bleed dodo because ama one be mehye mu a wo tie yaw because ama ya ase yaw ya dodo because ama wo menstruate wo bleed bebre ama wo menses nso be irregular wo bleed ene wo menses ba ne 2 weeks time na wo menses asan so ba biem doctor betimi agina no so akoyi fibroid no e de ama ba chomate ase enti niema na mo gina so na yi bebre anase afede aye kese dodo eji wa wodie no mu afa so wa me ankoyi e beduru ba bi no kisi eyi ene wa wodie no nyina etokone. Or say mine is at right side. Can I give birth? It doesn't matter. Me chere say ebi wo ho e daawodie ni mu aye kese daawodie ni mu e daawodie ni mu ba bia akora ba o betare nti agi ho na boso a remember so utimi nyam kora e betimi amanyin na sei so what I say and the fibroid and say nyinsen e daawodie ni insider ba bia akora na ba o betare no na aye kese a e betimi ama wo chances of getting pregnant na aye den na say nyinsen ne ba kora e betimi amanyin no asei. Njobi wo ha ne de na nya kese bebre na so ba bi eda no ene niema o go through o experience no ama obre doctor timi gina no so ekoyi ndina meka se si ebe you fibroid na gina ba bi eda eniema wo kom de wo experience signs and symptoms bi a wo kom ene ne kese aye kese omo consider sa niema no na yi ama ya frɛ bibi cesarean myomectomy. Cesarean myomectomy into 2-in-1. Into 2-in-1 no ewo. Cesarean myomectomy. Ebia doctor say oh, wo fibroid. O fibroid na yekese. Me assess o no. O ko wo a metima ye o CS. Ni mayi fibroid no so afiri ho aka ho. Into cesarean myomectomy ewo ho. The 2-in-1. But eno na na doctors nen tam penny because of the risk of what bleeding. Said the medical yakano. If you wait me bleeding afemu ama ya behwerew. Chomo nta anya sa ade no. Na say online ibi ana me hwe sister bi o so free because of no fibroid na okoye CS na so ye ni mienu. Enye easy sa. Enti say wo fibroid enka say me chenchene a me kwakọ me wo a me ma doctor na ye me CS na wo ye CS na wo yi ama me. It doesn't happen like that. And yet, the bia and on bit me a yama. It's 5 centimeters. 5 centimeters, is it big or small? 5 centimeters, and just too small, and then you're big and so, but then you're too small. Mostly around 8 centimeters, 9 centimeters, 10 centimeters. But said the Makano, Obi there is 5 centimeters, and so a man need bleedy during menstruation. A man was sexy or feel pains. And even though I can see be but they could consider to be on yama because of their own experience. Obi so there be 8 centimeters, 9 centimeters on experience she. Ti bi hokro mo she da nyima o de awo ne ba wa ye bibia okay. And one thing so say fibroid no say wo na utimi fam nyinsen a ebi wo ho a during pregnancy it shrinks or it degenerates. It me be ye ketwa. Nto you ho na fibroid ne so. Owo wiye no afi abeye kete. Ebia no measure be 8 centimeters, 7 centimeters. No nyanwo ye no. Owo wiye ye kwhwe ye na ka be 2 centimeters and 3 centimeters and 1 centimeter. Degeneration na kana. Onyema during hormonal changes and I say hormonal influence no it mean ma fibroid no etwentwom ebeye ketwa. But aya na eya it comes with pain. Ya wo ya ebra e degenerate na etwentwom na eye ketwa. Sa process na eye koso no it mean ma wo feel pains. Ya wo ya aya na nye easy kra. They complain of severe pain. Ara wo saman so no say yentimi hye da nye bibi kese bi amfa ho ma wo. And you can't do much about it. Painkiller yanum kakran na dia na dia so anu ama na dia so anu ama eventually say pain ne so tia na eso ate. So that is what happens during a year uterine fibroid. So fibroid na ekesi ase de meka no na omo ahwe na omo ayi de amawo. Ntu wo question na betim di aba. Betumi de aba na yahwe de amount. Oh, question bi a betumi di aba na yenhwe emfa emawo. Okay. 1 2 amhwe. Oh, question bi a ubetumi de aba. Okay. Cutie. Doctors, yeah. Who question na obetumi di aba about fibroid na yeyiyi ano de amamo ena anwumre eno ho nkomo na ye die na nkakra ye de beko ye ne mo ama subscribe ni nyina medamo ase. Say die me wo a meba live ewo eye TikTok na meba live nso ewo YouTube e de aka ho. I have to grow this enye adwuma ketwa adwuma na eden but minim say with time eno nso ebetumi grow nkakra enti na mench say bre ne bebre 46 minutes almost 1 hour. So question bi ama in the next 5 minutes manwie nyame bo a mesan so ababiem na ya befa the other side of uterine fibroid. Ti ase say o fibroid it does not mean you can't get pregnant. The person may establish sa and biem ye ni aduro biara enane fibroid. It means we so na ti ase menua ye ni aduro bia enane fibroid. It is all fibroid. Now ko na doctor so obeyi a emfa doctor na chi nko ne na afichire ho ese obi so o abibiduro bi obetimi dia ama na na fibroid na eyi se moja o menses. There's nothing like that. Ubakwa ko tutu sika na atu at the end of the day you go back and do the surgery. So many one come say doctor so obey me surgery dia meti ase na makoye surgery no prep. Ti ase sa bibia ni wa obi obeka cho so wo aduro bia ode be ma fibroid na ne bia me se wo boa. The person is lying. Aduro bia ni ho. Opa agidi. Open so akọ na kotie nipa ne de. But me de nka otie me de na nka me ne beje ho. Ye ni aduro bia na ne fibroid. Either say be your surgery and now ebi wo ho doctors will aduro a omo de prevent the growth hormonal changes. fibroid ni nim ade pote de ba nanso ebe wi a ade ebo no ma ne ye kese na enyini pa ye estrogen nti bi ho doctor ma woduru a emma wo estrogen level na ye low estrogen level no ndoso eba site mi ma fibroid ne shrink eye ketwa na no na ya na edi break akra open mprempren di a eno na surgery no edoso na surgery na edoso a omota ede treat eye fibroid no your fibroid embolization so they just try to disconnect the vessels no vessels not connected to tasa mama vessels not connected to a nourishing no ma try to disconnect it said the bear vessels be any day and nourish fibroid until na no nkakra na shrink that is fibroid embolization but the commonest treatment is surgery doctors yes surgery no more year free ho the amount so anyway kakra yebesua ye ni minim se sister na obi sa fibroid no asama me ka say no nti meba ha me yesua no me sure so wo ha wate bebre afa fibroid ho nti so obi wo question bi a mpamcho obetumi e de abasesi e nye sa de a ya ye 49 minutes e de besi ha na madam wase papa in fact mo ba pa o ma ya de pa mensusu kura se ni pa ma ba mo beba very very encouraging pa me hu say inu anu bi nso a subscribe to it enipa menya nipa be say 10 analysis here aka ho which is not very bad so kakra we will get there and it will help and mo amoka say memra live no mo ya de pa I think say live no so live session no bo ma otimi nya subscribers ni bi eka ho etimpacho wunya follow me a ana wunya subscribe ya no subscribe bi am Johnson why na me videos nso amaye no wo betu bi so a na wahwe bi na ye nyina let's grow this together let's promote maternal health ebetumi aboa entebusafo ye de bisi ha nwumre ni akoda ene ma ya ade pa ma ye TikTok ma ye YouTube saa na mekoso a try enye easy at mekoso a try ti me dem nyina amase mo am ba ye me nuanom ne me yere nom ne me namfo nom ne me bibia gg cutie odene ho atasa woman akoso abana Emma the beautiful humble queen ene chesemo amoba ye ni nyina Elina class captain me niema medui sister Joyce na mo amaba ni nyina Ophelia mo amoba ye ni nyina medam nyina mo ase sister Dorcas okay enti chele mo amaba ni nyina medam nyina mo ase papa eno anu no monkoso a monta machi agi say ayi petrol enti wumma ya no subscribe bi ama munya wadamfo bi anu aka say hey chale wo yo banko a wosiso a wo dia subscribe me do have Johnson ni page ni bi na wo besua ade bebre enti anwumre e de besi ha na yakọ akoda ayi kura ayi camera no kura efe YouTube camera no kura e guy pa ahụ zam chire no enti ya mumra na yentimi cutie chale mumi yankoda we de na mo nyame atasa menkwa na me ye dede no aha ye official yekoye ye ho fia ne aba official no so yekoye ye ho fia ne aba official no so saa na ebe ye no yekoye ye ho fia wo kwan no ho a ne aba ha aba be ye ho yie yekoye ye ho fia wo kwan no so ho a ne aba ha ne aba be ye ho yie so aha ye professional field aha de untumi en request but ye bekoso na yesua de chale yami nshira mo nyina ye kwa akoda till we meet again. It's peace. Shalom. Have a wonderful evening and God bless you for coming. Unyan subscribe ya Mr. Subscribe with mommy. I a professional field. Eti muma nyina yenkonkoda. Ade patch ya aseda na mede mama mo amoba ni nyina se mo support ama yetimi ayesa discussion we. Ye besan so abeto so in the course of the week. This week besan so ba live beam ewo YouTube. Thank you so much for your time. Elina, chale nyame nshira o. Nyame nka we nyina ye ho na omboa ye. Good night. Cheers. Bye bye. All right.